Welcome back. It's now to talk health. Regenerative medicine is emerging as one of the most promising areas of modern healthcare, focusing on ways to help the body repair and replace damaged tissues. Hospitals are already applying these techniques to speed up healing the severe injuries and reduce the need for organ transplants. Now, patients benefit from faster recovery, fewer complications, and more personalized care in Nigeria. Now, as research expands, experts say regenerative medicine could transform how chronic diseases are treated in Nigeria. Now, joining us for this conversation is specialist in regenerative medicine, Dr. David Ikudaisi. Good morning. Thank you so much for joining us on TVC Breakfast Saturday.
Good morning, sir.
Good morning. Thank you for having me on your show.
Now, walk us through what we know as regenerative healthcare in Nigeria. This new initiative, how can this better the lives of Nigerians?
Okay. First of all, for those that may not be familiar with the word or the area of field, regenerative medicine, let me break it down. Is that field of medicine, that is focusing on repairing, regenerating, rejuvenating, and restoring damaged tissues, organs in the body to normal functioning state. And that is done by using the human cells, the human's healing ability, and that helps a lot to accelerate recovery. So pretty much you can use the cells like the fat cells from the abdomen, the bone marrow cells, umbilical cord, stem cells from newborn baby, and exosomes. And this has been, giving a great result all over the world.
Okay, so I like the fact that you actually spoke or mentioned on the umbilical cord from babies now. But before we get there, what diseases or challenges in the human anatomy will we say address or can be easily or very quickly be addressed by regenerative medicine and stem cells?
Yeah, although I will say some, it is easier to say what cannot, because those are
what cannot, okay.
That is few.
Okay.
So pretty much majority of the medical conditions can be addressed from children to adult. Things like arthritis, stroke, diabetes, chronic disease, autoimmune diseases. It works very well, for that. Okay. Yes, it will not kill malaria parasites, but somebody has surgery, they can recover quickly if regenerative medicine procedures are added. Sight, high problems, spinal cord injury, the list is just enormous. Cerebral palsy, autism, like I said, the list is.
So of what benefit can this bring to people who need this regenerative medicine? What are the positive things? Are there complications?
Okay. Because most of the cells are from our body, so our body tends to accept our cells back. Like good example, if fat from your stomach can be put in your lips, your face, or maybe you know what the ladies do currently with it.
Lipo.
So they put it at the back there. But the point is, if it is done properly, your body will not reject it.
Okay.
And the one that is not from you, like umbilical cord that you mentioned, those cells are primitive. That means, let me rephrase that. Those cells have immune privilege.
Okay, so before you go forward and rephrasing that, let me go. So so people have actually come out to say, okay, you know what? After a mother puts to bed, she can go ahead to eat her umbilical cord, and then that will help her. Even get over postpartum better, breastfeed better. It helps the baby and things like that. We've even seen celebrities like Cardi B, for instance, do things like that, where they actually, even the Kardashians as well, they literally maybe dry it up. I don't know, there's a way they go about it, put it in pills. They probably take pills per day. So would you advise that, and does that make any sense?
Well, and that is not regenerative medicine.
That's not
that's what to do with
that's different. Okay.
Yeah, so I probably leave that on the side.
Okay.
But that being said, you see, this for three of us to donate blood to each other, we have to be compatible. But when it comes to umbilical cord stem cells, they are immune privilege, which means they do not trigger reaction rejection they really not been exposed to the environment to be able to cause that. So that gives us the ability it allows anyone to use properly harvested umbilical cord stem cells that is well processed.
That is well processed.
Yes.
So where is the place of Nigeria here in this new initiative, talking about regenerative medicine? We have countries like Japan, South Korea, Germany, US, and China leading in all of these developments. So where are we in this?
I'm surprised you did not mention USA.
yeah, US.
It goes without mention.
Because I practice in USA. All my training is about regenerative medicine. It's in USA, so I practice in USA and Nigeria, both Lagos and Abuja. But Nigerians are becoming more acceptable, thanks to the technology, and most people do travel out. So when you have a problem, and we orthodox doctors say there's something else we can do for you, and you do understand that there has to be something, that is where regenerative medicine comes in.
Okay.
So it offers hope. We are trying to manage or treat something, but regenerative medicine now is going towards curing and things like that. For example, sickle cell disease is more common in Africa, okay? But there's already FDA-approved cure 2 years ago for sickle cell disease. UK has a protocol which is less expensive than US own. And Nigeria next year too, there's a center that's going to be treating people with sickle cells. With what we have been doing in Nigeria, a lot of people, we have patients that have stroke that cannot talk for 2 years, cannot move for 2 years. Within 1 week, 2 days, they start making ability to, sounds. Within 17 days, they are talking. 3 months, walking without a support with a cane. Yeah. So these are the things that regenerative medicine is doing. People with chronic kidney disease, getting their progression slowed down, stop, and then function reversed. And there's an improvement in the stages of the chronic disease. People on diabetes getting off diabetic medication, or autistic child, able to communicate, call the mom's name, point to things I need. Cerebral palsy children that cannot walk, you have to drag them within 5 months after 2 treatments. They're able to stand up, walk towards their therapist. These are happening in Nigeria for years. Arthritis that needs surgery.
How cost effective is all of this? Because when you talk about this, those who are watching you at the moment will say, it's not cheap.
Well, it depends on which one. You see, regenerative medicine comprises stem cell therapy and platelet-rich plasma therapy and gene therapy. The gene therapy is probably the most expensive, and that's where sickle cell comes in. Like the center that is going to be doing this in Nigeria, they're looking towards philanthropists to also support that treatment. But that being said, when it comes to arthritis, you can use your own blood. That is really affordable. Then when it comes to stem cell, yes, stem cell is more expensive than platelet-rich plasma. But retired grandmothers and are having stroke. They can't talk for 5 days. The next day, within 24 hours, they are talking, moving there. I mean, people, it depends. It's affordable. And then, if it's still expensive for the person, there's a recently approved product in Nigeria, this stem cell and natural stem cell enhancer. So it's not stem cell itself. It's not those ones that they've been selling powder, drink, no. It's a US-made product that it moves your own bone marrow stem cells out of your bone so that your natural God's-given bone marrow stem cells is healing you as it travels around your body.
Okay, so now let's talk about the ones you mentioned, the one they're selling as powders and drinks and all of that.
Yes.
Is that effective and is that even advisable medically?
I see them more like herbs because most of them are plant-based. So stem cell cannot exist. Human stem cell cannot exist in any plant. I mean, we are human beings. That's why if you cut your finger, for example, by mistake, they put it in the eyes and they rush you to the hospital so that maybe there's time for the doctor to reconnect that cut off finger because you have to preserve the cells. And regenerative medicine products that are not from you directly, like umbilical cord, it has to be preserved in cold, temperature. So all those powders, they are not real stem cells.
Okay, okay.
Are there some risk challenges? Because I read through that, does it change the immune system? So people have raised the fact that there's a tumor risk in some of this regenerative medicine that we're seeing at the moment.
All right, then that breaks, to make it simple then for the viewers. When you talk of stem cell therapy, there are 3 types.
Okay.
One is embryonic stem cells. It's considered unethical. It is the most powerful one because it has pluripotent characteristics, and because of that, scientists could not or cannot control how it grows, and many countries are against it. So the second one is induced pluripotent stem cells, taking the characteristics of the embryonic, but because it's not embryos that is potential human being, so it's considered ethical. But still, they were struggling to control how it grows, but in the last 2 years, now they've gone to the clinical stage. So that is, and finally, the third one that is safe, that is clinically practiced all over the world, including Nigeria, is adult stem cell therapy. The adult is not about age, it's just to differentiate from embryonic. And that's when you talk of using the fat from your abdomen, your bone marrow, umbilical cord, stem cells, and exosomes. And bone marrow was first done in 1968. Although they call it bone marrow transplant then for immune system. Or you mentioned immune before. Regenerative medicine, biologics, yes, we all thought that it's good for regeneration of the organs. Only for scientists to find out that they have more immune modulation properties. That is, they modulate your immune systems, keep the body from attacking itself. And the immune system respond very well. Like a kid 9-year-old without hair, within 10 months growing afro.
Okay.
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 So because of autoimmune disease.
Okay, so now let's bring it down to layman's terms, because we want our viewers to understand it. Just like, you know how they say, explain to me like I'm a 5-year-old.
Okay.
Let's use the situation of something that's kind of prevalent here in Nigeria, especially in the Lekki axis. We talk about liposuction and how a lot of women now are going into all of that, I mean, to enhance their hips and bodies and things like that. So now, what role is it playing in that regard? Just as a general example, so everyone can understand what regenerative medicine really is.
All right. Now, you are talking about the cosmetic or aesthetic application of it. Those people doing like the BB hair and augmenting their face or chest using the fat, like from liposuction, it's not regenerative medicine.
Okay, it's
because
not.
It's not. That they are not regenerating anything. They are just enhancing whatever they want to enhance.
Okay.
Now, that being said, for you to use fat for regenerative medicine, you cannot do it the way you do liposuction. Okay. All the fats, all the stem cells will die. Okay. It has to be done in a certain way. And when it's done, nobody even know that a doctor taught you because you don't need that much fat. Does it give it the same effect that is required? When you do it the right way, yes. Of course, you have to extract the fat in a certain way, different from the regular liposuction way, to preserve the stem cells. Then you spend another 4 or 5 hours extracting the stem cell from the fat while the patient is just waiting for you. And when you are done, you come to the patient. Then if it is stroke, if it is diabetics, if it is kidney disease, depending on what you are treating, or spinal cord injury, then you now introduce it or transplant it to the patient's own stem cells derived from the fat back to the patient, and the patient goes on. So all the centers that really do it are clinics, not medical center, not hospitals. Why? Because back to your safety. Okay. If you do it right, there's really nothing to worry about. So no need to keep anybody overnight. Are you saying for someone who has a kidney problem? Because we have statistics saying about 25 million Nigerians, especially in the Northeast, battle this challenge. Are you saying that there won't be any form of transplant and it will be done without any form of complications? Okay. Well, I'm saying something like that. The answer is yes, because in Nigeria, there are patients, not one, not two, that have had reversal of the deterioration of their kidney. And it takes how many days or months? You start seeing improvement within 3. Anything we do, most of them is 3 weeks, but we take patients 3 to 4 months to see result. All right. It's a fine place to leave it. All right. Thank you so much, Dr. Ikudaisi. It was a pleasure definitely having you here. Thank you so much for joining us. And of course, still ahead on TVC Breakfast, we'll discuss the final judgment by the Supreme Court concerning the Osun local government autonomy. Stay with us. We'll be right back.